born. And there are those ones who they deliver a baby and then complications arise and the baby dies later. And sometimes the baby was born crying and happy, but then afterwards things just turn, south and baby dies. It is the worst. I tell you, it's the worst feeling anyone can ever go through. I'm so sorry if you're one of these moms. I'm so sorry if you are one of the people who have been affected by this, either now or in the past. It is an emotional and a very, very devastating experience that you could ever go through. It's not even something that you wish on your worst enemies. So sorry for those ones who have gone through this. My heart goes to you. How do you go through this? One of the things that can be such a challenge for these women is that sometimes you may not have answers, or the doctors may not have answers as to what happened. And there is lack of closure because then you're not so sure. So even if I get pregnant next time, will this happen again? Is it something that is preventable? Will it occur? How can I make sure that it doesn't happen? And that uncertainty and lack of closure can be very numbing in itself. So that can be quite a big problem. And more than 50% of the times, we actually don't know a reason why you lose your baby after birth, what we call fetal demise. Okay. There's usually a lot of self-blame or a need to blame someone, and there are women who blame themselves and they reach out for straws, of a reason why this might have happened. There are people who say, oh, if I hadn't gone for that journey, if I hadn't eaten that, if I hadn't done ABCD, if I hadn't remained in that relationship, if I hadn't, if I had, and if I hadn't, there's a lot of what ifs, and it kills you, to just go through this list and possibilities. Most of the time, let me tell you, there is nothing you could have done. Yes, sometimes there's things that maybe you could have done. For example, if there was some danger signs that you missed, and you feel like maybe if I went to the hospital in good time, this could have changed the situation. But a lot of the times, there is really nothing you could have done, and it wasn't because of ABCD that you did or didn't do that things went the way they went. So there's a lot of self-blame and just, need to absolve yourself of that. There's also a lot of blaming the health professionals. There are those people who blame the doctors. There are those people who blame the nurses. And sometimes it's a valid blame, or sometimes it is not. It's just you need someone to blame for the bad experience that you're going through. Sometimes it comes also with the issue of, your baby was born, got complications, they were in ICU for a long time and they die. And you also have the bills that come with that. So you're sorting out bills, and ICU care is not cheap. And then you don't have a baby to take home. There is also a lot of anxiety with the subsequent pregnancies that just come from this, especially in those situations where you didn't know what happened and therefore you don't know how to prevent it. There's a lot of uncertainties, and there are people who have crippling anxiety and fear when they're pregnant again because of just the past experience. They don't know how to prevent it and how to just make sure that it doesn't happen again. Again, the good news is that most of the time it's an isolated event and it's not something that will keep happening over and over again. All right. So what can you do if you have had this experience? I would say getting the necessary help is important. If you can get answers to what happened, it can be a good way to know what to do next. Also, even for the doctors or the healthcare professionals, having an answer of what led to this, what caused this, helps us in also trying to prevent it from happening again next time. One of the common causes is usually diabetes. Another common cause, it could be pressure, high blood pressure, what we call preeclampsia, or sometimes it's bleeding that is very severe because the placenta has separated, or the placenta is in the lower part of your womb. these are some of the things that can lead to that. Sometimes it's because of abnormalities in the baby organs or infection that has affected the baby, and this leads to death of the baby. So getting answers helps. And one of the things that we do to try and get answers, of course, is just, of course, knowing the events that led to this. So having history, examination, and understanding what happened in the days or in the hours that led to childbirth and the outcome that you have had. And also doing investigation. So sometimes we may investigate the placenta. We may take a section of the placenta. Sometimes we may need to take some fluid, the amniotic fluid. Sometimes we may need to do postmortem. And postmortem, I know most parents usually don't want this, but it can help a lot in just trying to get answers, and answers are good because it helps us prepare best and know how to avoid this from happening in the future. So if you can get answers, it will be good. So speak to your doctor. However hard it is, try to listen and understand what happened and how can we avoid this in the future. Getting emotional help is important. There are most of the time, when someone has been affected or a family has been affected by a loss of a baby, we offer them counseling. And there are people who don't want it, and it's okay, we respect that. But most of the time, it's been shown that getting counseling is very important, because you may not know you need it until you actually have a session and you realize how much you really needed it. So if you can get therapy and just psychological help, it will be very good. And we encourage you to get it as a lady. We get it to get it as a couple, or even as a family, with even the children back at home, because we're also expecting a sibling who doesn't show up. So even involving the whole family is very, very important in just getting this therapy and trying to cope with the situation. Getting help in terms of trying to sort out complications, that may have persisted even after getting this bad outcome in your baby. So it might be a pressure thing, it might be a diabetes thing, it might be the bleeding issue. So getting help even as a woman to recover your body, even as you mourn the loss of your baby, is also very, very important. So it may be hard, but try not to forget your own self so that you heal as well from all the complications that may have happened to you that led to the kind of outcomes that happened to your baby. Okay. I would say also just taking time to process the whole situation and try to heal from it. I know that it may take a lifetime to heal from this, but trying to get pregnant to sort this out may work, may not work. Sometimes it varies from person to person. What I would say is try not to sweep it under the carpet by getting pregnant haraka, so that you overcome the grief. It may not work at all. Or sometimes you may get pregnant and you are not ready emotionally and psychologically to deal with that. And then you just have a lot of anxiety and a lot of fear during the entire pregnancy, which may be worse. Or sometimes you may hurry into it and your body has not recovered or resolved the issues that led to the loss of the baby, and then it happens again. So give yourself time and just go a day at a time, dealing with whatever grief that you are dealing with. Okay. Get support, psychological support. We have support groups. We have many groups that deal with moms or try to support moms who have lost babies. So try to get support groups. Try to talk with women who have gone through this. Working together is always better than working alone. So try to be with someone who can hold your hand and help you go through this season. Remember friends, remember family, people who can hold your hand, even neighbors. Try to just get help so that you're not alone, because depression is also one of the very, 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 very key things that can happen during this time. The other thing that can also happen is marriage breakages, relationships just going in disarray. And the reason why we see this is also because the spouse may mourn or grieve in a different way compared to you. So ladies and men handle grief differently, and sometimes one partner may feel like, this other one doesn't feel as much pain about the loss as I am. And sometimes it can also be because of depression and feeling very down and, just aggrieved. it breaks your bond and just keeps you aloof and alone, and relationships are broken because of such kind of an outcome in the postpartum period. So again, what I would say around this is get therapy together. Try to understand what your partner is going through so that they also understand what you're going through, and see how you can go through the whole process together as a family. Remember the children as well, because most of the time you may feel as parents you're the only one who are aggrieved, but even children mourn the loss of a possible sibling that they haven't met. So remember the children as well. All in all, remember your friends who are going through this. And if you're going through this, remember that you're not alone. Get help, stay connected with people, and get all the help that you can to try just help you go through this very, very difficult season. Take a day at a time.